Hello, good people. How are you today? I hope today finds you well and in perfect peace in no matter what area of your life that you would love to be well in and operate in a level of perfect peace. So today is June 20th, and that makes it the 20th day of Uterine Cancer Awareness Month. As a uterine health advocate, I felt it was important for me to align myself with the awareness and to participate with the initiative. And so every day during the month of June, I am committed to providing information about uterine health or uterine cancer. Excuse me. And I also want to take the time to say thank you. Thank you for your engagement with this channel. Thank you for viewing the videos, commenting, liking, subscribing to the channel, all the things that bring traction and engagement to this channel. I really do appreciate you, and I thank you so very much. So I always like to, it is in my description, but I always like to say it verbally that it's my disclaimer, I am not a medical doctor. I am a uterine health advocate. So on this 20th day, I thought I would address a very popular subject regarding uterine health that I have yet to talk about, and that's fibroids. And I'm sure people have heard about it. Some people are still curious about it, but there's so much information out there for you to learn and learn about fibroids. And of course, I'm a big fan and advocate of you talking to your doctor or medical professional as well, if you have any kind of curiosity. So recently, a well-known celebrity shared that she was just diagnosed with fibroids. And I believe she said she had over 10 fibroids in her body, or maybe even more than that. But, I was really grateful and kudos to her for using her celebrity platform to be transparent, to be vulnerable with the world and say, this is the condition that I was just diagnosed with. And these are the tumors that are living in my body, to help spread awareness and provide more information about fibroids. She was able to go on all the talk shows and things of that nature. So that's why I say everybody has a place in the world. She was able to reach people by the masses because of her, being a celebrity. And that, I think, is just wonderful that she took the time to share her personal journey with the world to bring awareness about that. Because we know women have been diagnosed with fibroids for years, but I think it's one of those silent, talked about but not talked about conditions. Someone may say randomly, I have fibroids, and somebody else say, you too? I had fibroids too. I have fibroids too. I think it starts off like that, but it's not something like the celebrity did that openly say, oh, I got fibroids, and let's talk about it. So it's a silent, talked about but not talked about condition is what I like to say. So I did my typical internet research, and like I said, there's tons of information out there, and so I want to provide to you today the information that I find. And please remember that I am just providing you with top level bullet point information to hopefully spark you to go deeper in your own personal research. If you're curious about fibroids, or you think you may have fibroids, or you've been diagnosed with fibroids and maybe you need a little more information, and just to give you some bullet points and tips maybe to talk to your doctor about fibroids, if you have any concerns. So fibroids is actually the official name. We say fibroids, but the official name is uterine fibroids. So uterine fibroids are non-cancerous tumors made up of smooth muscle cells and fibrous connective tissue that grow in, on, or within the walls of the uterus. So when you are diagnosed with fibroids, they are non-cancerous tumors that grows in your uterus, on your uterus, or within the walls of the uterus. And these are tumors that they typically label as benign. Benign means non-cancerous. And they are extremely common, affecting most women by the age of 50, and range in size from a tiny seed to as large as a watermelon. So fibroids are also referred to as leiomyosis, or myomas, leiomyomas, sorry. Because they are never cancerous, small fibroids that do not cause symptoms often do not require active treatment and can simply be monitored over time. So we see that it's called uterine fibroids, and we see that they have other names for it as well. And because, they're almost never cancerous, so if you get you're diagnosed with a small fibroid, that does not cause any symptoms. It often doesn't require any treatment, and just simply can be monitored over time with your doctor. That's the good thing about it, right? That, someone says you have fibroids, it's a tumor, because typically when we hear tumors, that's usually associated with some form of cancer. So that's to be grateful for, right? But it's good to know that if you are diagnosed with it, that you do monitor it with your doctor so you can check the growth or anything like that that's happening, because, we're all different and our bodies are different and we have underlying conditions. So what may affect me one way may affect you another way. So it's important not to just brush it off if they tell you it's the size of a seed and you don't think any more of it. And it's your responsibility, let me just put this here, to make sure you're monitoring your fibroids and you're bringing that information up to your doctor. It's not, your doctor should be saying, let's check your fibroids, or, whatever, but it's still up to it's your responsibility because this is your body. That's what I do want to say. So some of the key characteristics of uterine fibroids is three of them. One, they're benign in nature. Fibroids do not increase the risk of uterine cancer and will not turn into cancer. The second characteristic is the location and the growth. They can grow as a single tumor or in clusters and can develop inside the uterine cavity, within the muscular wall, or on the outer surface of the uterus. Hormonal link. They typically appear during childbearing years when estrogen and progesterone levels are the highest, and they often shrink after menopause. So the key characteristics of uterine fibroids is they're benign in nature, the location and growth. They can grow as a single tumor or in clusters, and can develop inside the uterine cavity, within the muscular wall or on the outer surface of the uterus. Hormonal link is the other thing. So it's typically start happening during childbearing years, is when your estrogen and progesterone levels are the highest, is when you can often get diagnosed with fibroids, and then they do shrink after menopause, they say. So some of the common symptoms. Many women with fibroids never know they have fibroids because they experience zero symptoms. However, depending on the size and the location, large and numerous fibroids can cause the following. So, large and numerous fibroids can cause the following: heavy, prolonged, and painful menstrual bleeding, which can lead to being anemic; pelvic pressure, bloating, or feeling fullness in the lower abdomen, stomach area. Sorry, got that messed up. Frequent urination if a fibroid is pressing on the bladder, so you'll have to go to the restroom often. Lower back pain or pain during sexual intercourse, and occasional complications with fertility and pregnancy. So I can be honest and say this is me. I used to run marathons, which is 26.2 miles. I always have to put that in. Sometimes people say, I ran a marathon. How many miles did you run? 3.1. I go, oh, that was a 5K. Marathoners, we want our whole 26.2. So I was running marathons, and it was at that moment that I discovered, my doctor discovered that I had fibroids, and they were fairly large. And she was wondering, was I in any kind of pain? I was not. Did I have any symptoms? I did not. And she was surprised that I was able to work out like I was, and really train all of those months for those marathons and other events that I was doing that particular year. So I said, yeah, I'm very grateful I didn't have any symptoms. So again, it can have heavy and prolonged menstrual cycles, pelvic pressure, frequent urination, lower back pain, pain during sex, and complications with fertility or pregnancy. So some of the treatments that they provide for fibroids, they said, if fibroids cause significant discomfort or impact your quality of life, a range of treatment options are available to manage the symptoms and to remove the growth. Because I do know some people, it has really, caused them a lot of pain where they just had to have treatment for the fibroids. So there are 4 treatments listed here. The first one is medication. They'll give you birth control pills or IUDs to manage the heavy bleeding and over-the-counter pain relievers. The second thing is they have non-invasive procedures. like an MRI guided focused ultrasound to destroy the fibroid tissue. They have minimally invasive therapies like uterine, they call it UTE, uterine artery embolization. And then with that procedure, it blocks the blood supply to the fibroids. Or they have radio frequency ablation. I talked about ablation in one of the videos previously. And then they have surgical options. There is myomectomies, where you surgically remove the fibroids while preserving the uterus, and in severe cases, hysterectomy. So let me just, say this, that, the treatments, medication for your heavy bleeding, they said they could give you IUD and a birth control. So that's trying to help with manage that heavy bleeding. And then the non-invasive procedures, where the MRI, is a guided ultrasound to destroy the tissues. And then the minimally invasive therapies, your UTI, where they block blood supply to the fibroids, or ablations, right? And then they talk about the surgical, options, which is myomectomy, which is the removal of the fibroids while preserving the uterus, or in severe cases, hysterectomy. So it's nice to know that they have all of these treatments available now. Because so many people in the past, they just have told people just to have a hysterectomy and then that's it. And that was their only option. Recently, I went to a women's forum, and one of the women there just shared her testimony about fibroids. And one of the things that she did say is that she was able to work on a plan with her doctor to try different things before she had to have the hysterectomy, because she had heavy bleeding. She had really a severe case of it. And so I think about maybe like after 5 years of trying different things, she finally decided to have the hysterectomy so she could relieve herself of all of the horrible pain that she was facing. So it's really nice to see how modern medicine is growing and adapting and developing new things, and know that hysterectomy is not the first option, but the last option. So some of the risk factors for having uterine fibroids. So some of the risk factors, other than being a person of, reproductive age, this includes race. That's the first thing they come out with. They said all women of reproductive age could develop fibroids, but Black women are more likely to have fibroids than any other racial group. Black women have fibroids at younger ages than white women. They're also likely to have more and larger fibroids, along with the worst symptoms, than white women. I find that just so amazing to me. I do. That, because I am a Black woman, to know that we are more likely to get it. And fibroids start, we get it at a younger age, and then we're more likely to have larger and more fibroids and the worst symptoms as well. The other risk factors is family history. So if your mom had it, your sister had it, it could be likely that you'll have it as well. You're higher risk of getting it, I should say. And other factors, they say, for risk factors for being diagnosed with fibroids is you starting your menstrual cycle before the age of 10. They say obesity, being low on vitamin D, having a diet high in red meat and lower in green vegetables, so you're not having a balanced meal, fruit and dairy, drinking alcohol, including beer, that sometimes, these sometimes raise your risk of getting fibroids. Now, I listed all these food things and, like your vitamin D and these things. I don't think that instantly you should just, cut everything out. I do believe in moderation. I do believe in balance, but I do believe talking to your doctor and seeing what is it for you, because it may not be it for you what it is for me. So begin to talk to your doctor. We could easily say obesity, right? But then there may be another cause why a woman is not what they deem, you know what I'm trying to say, but I'm trying to be politically correct here. What they deem is the correct, I think it's the BMI, what they deem that you should be weighing, because there may be other underlying conditions that prevent that woman from losing weight. And there's other conditions. And, some people are fairly larger than others. It doesn't mean that they're unhealthy. It just means that they could just have something else going on with their bodies. So please let us take the stigma away too of body shaming women, because there are women that are the celebrity that shared her fibroid testimony. She is not. She's a what you would call a celebrity, I guess, celebrity body. You have to be thin and all of that stuff, and she's gorgeous, of course. And so, yeah, I just don't want people to think obesity and instantly think, oh my God, no, don't do that. So I would be remiss if I didn't circle back on one particular subject as well. Although they say that fibroids, are typically benign in your body. So when you have them, you can have a small or clusters, and they're all benign, non-cancerous tumors. But I did talk about um, a couple of videos ago, and I highly recommend you go back and review it. It's about sarcoma. So, like I said, uterine fibroids are typically benign, and they rarely turn into cancer. However, there is a rare form of uterine cancer called lymosarcoma, and which can develop and mimics many of the same symptoms as fibroids. And the most critical red flag requiring urgent evaluation from your doctor is really when you're postmenopausal and you have postmenopausal bleeding, or you have a rapid growth of a mass and a severe or sudden worsening pelvic pain. Many of the symptoms of benign fibroids overlap with the sarcoma. So certain signs warrant prompt medication from your doctor to rule out some of the symptoms of possible cancer indicators, right? So there are four of them. The first one is postmenopausal bleeding. The most significant warning sign: any bleeding or spotting after menopause is a major red flag. Please go see your doctor immediately. It could be something as simple as a cyst maybe, or it could be, or not a cyst, excuse me, as a polyp that can be removed. It could be something that, your uterine lining, something's going on there, or it could be a potential flag for sarcoma, which is cancer. Another concerning red flag is rapid growth. So while fibroids are benign, if they grow slowly during reproductive years, a sarcoma can cause the uterus to expand very quickly when it's not just benign fibroid. So your uterine can expand quickly. And the last one is unexplained significant weight loss. A general symptom that requires immediate cancer screening is that. So one of the things I touched on in the sarcoma video is that a lot of times people don't realize, because the doctors may see it because they do an ultrasound, they see it as fibroids. But a lot of times they don't know it's fibroids until they're in there maybe doing another procedure for you, or you're having a myomectomy or hysterectomy, and then they see it and they go, oh, this is cancer, not just a regular fibroid. So that's why it's kind of hard to determine, and that's why they call it rare. Very few people, I can't think of the numbers that get it, but I may have mentioned it in the last, that sarcoma video. So I highly recommend that you go and check that out. So if you're postmenopausal, any kind of bleeding, whether you're postmenopausal or not, any type of bleeding is important for you to go see your doctor immediately. So I just didn't want to leave that out there and you think that, oh, you got fibroids and it's non-cancerous. You can, if you want to, you can talk to your doctor about it if you see any of the risk factors. So I'm going to talk about, so there's overlapping symptoms in both sarcoma and uterine fibroids. You can have abnormal vaginal bleeding, while benign fibroid causes heavy or prolonged periods. Cancerous fibroids can cause irregular bleeding or bleeding between periods. So when we're having blood come out of our system, we just have to pay attention to our bodies. The other overlapping symptom is pelvic pain or pressure, persistent, severe, or worsening discomfort in the lower stomach area, pelvic region, or lower back. We need to really check that out. So pressure surrounding your organs is a third overlapping symptom. So if you have frequent urination, difficulty emptying your bladder completely, or a chronic constipation. The last one is stomach swelling. So you have a feeling of fullness, bloating, and you feel maybe like a mass in the lower stomach area. These are overlapping symptoms. Because again, like I say, when they do the regular ultrasound, they can look alike, but they're very different. So that is why I say if you have any pain, any discomfort, if something is severe, whatever it may be, please go see your doctor. When you go see your doctor, don't try to be that strong superwoman. Tell them everything that you're going through so that hopefully by you telling them that, you can get a proper diagnosis. Hopefully by you hearing even one of the topics that I'm sharing, or you see somebody else sharing, that you can do a little research and ask your doctors, can I test for this? Can we rule out this? So that this helps you plan for a better, I think, health goals. It helps you plan for, I just think longevity. If the more the better questions you can ask your doctors, and the more they can rule out things so that you can feel comfortable as well. So, per usual, I have articles for reference regarding fibroids, and they will be in the description. The first one is from the Mayo Clinic, is Uterine Fibroids. The second one is from UCLA Health. It was written in March 2025. Why do 80% of women develop uterine fibroids, and what can be done to prevent them and treat them? The third one is from reproductivefacts.org. It was written in 2023. What are fibroids? A patient fact sheet and booklet. I like this one because I do believe they had something that you can kind of download and keep on your phone or your tablet or your computer. The fourth one is the South Lake OBGYN Center. It's Fibroid Symptoms and Cancer, Understanding the Connection. I thought that's a good one to read too. And then the USA Fibroid Center, titled Fibroids and Cancer, Symptoms and Differences. I think it's important that is also mentioned. So I just think it's important that's an area I don't see many people talking about, that, your doctor has to know the difference, and you need to know the difference. So I hope this just quick overview of fibroids, kind of give you some kind of insight into what it is. I'm personally going to say that one of the thoughts in my mind, I thought this only affected Black women. That's all I ever hear was Black women saying that they have fibroids, they have large fibroids, they had so many of them. I never heard any of my white counterparts saying that they had fibroids, and maybe they had it, didn't know, maybe they had it, just didn't share it, and that was their right. They could do whatever they want. But I just thought it was pretty interesting that was a myth. And I'm so glad that has, the more that I'm doing research, I'm learning that is not true. It can happen to all women of childbearing age, and not just African American women. So that's a myth that's been busted, right? So it's good. That's why it's so good to do research, because you'll hear these things and these thoughts you make up yourself. And then once you do the research, you go, oh, well, that's not true. So it makes you, I just think, a little more educational about one more subject regarding uterine health. So I hope that you are, continue to have a great day. And I hope that I will see you again next time. Until next time, talk to you later.